very much, Angela, for the lovely introduction and for inviting me here today. It's truly an honour to have this opportunity. And I'm really here as a concerned health professional who has witnessed the negative impact of unhealthy diets over the last 21 years in my practice as a hospital doctor in the National Health Service in the UK. Our food system is at the centre of four urgent global crises: health, climate, biodiversity, and soil. There is also a fifth crisis, one of ethics, whereby our food system harms people and animals and keeps nearly 1 billion people hungry, and this is despite producing enough food to feed 10 billion. In addition, our food system is a major driver of antibiotic resistance, air pollution, and pandemic risk, all global issues adversely affecting health. As mentioned by Angela, to be fit for purpose, our food system needs to provide healthy and nutritious food, be sustainable for producers, society, and the planet, be affordable and accessible, culturally adaptable, and also kind and compassionate. Currently, the global food system fails to meet these requirements. 1 in 5 deaths globally are a direct result of an unhealthy diet, a diet that is too high in animal-derived and processed foods and too low in whole plant foods. A review of global diets in 195 countries concluded that a suboptimal diet is responsible for more deaths than any other global risks, including tobacco smoking. A large number of reports over the last year have emphasised the need for an urgent transition to a plant-based food system for both human and planetary health. I highlight here data from a report by the EAT Forum titled Diets for a Better Future. The study examined how national dietary guidelines in G20 countries need to be shifted to improve human and environmental outcomes. The foods associated with the greatest benefits for health and the lowest environmental impacts are highlighted with my green circle and are fruits, vegetables, whole grains, legumes, nuts, and seeds. The EAT Forum report shows that Australia has the highest per capita food-related greenhouse gas emissions of G20 countries, as shown on the left, and that the current dietary recommendations exceed food system planetary boundaries, which is shown on the right. If all countries consume the diet of high-income countries, we would need 7 planets to feed the world. Of course, the impacts of these unsustainable diets, such as climate change and biodiversity loss, is felt more acutely in low-income countries who contribute the least to these harms and have less resilience to cope. It is clear that without addressing global diets, we will not be able to limit global warming to below the 1.5 degrees Celsius set by the Paris Agreement in 2015. The Planetary Health Plate, created by the Eat Lancet Commission, is a reference diet that will keep the food system within planetary boundaries whilst improving human health and preventing an estimated 11 million deaths globally per year. It is predominantly a plant-based diet, with animal foods considered to be optional and, if consumed, contributing to less than 15% of energy intake. This amounts to 1 portion of red meat per week, 2 portions of poultry, and 3 eggs, for example. This type of diet would be expected to be culturally and geographically adapted, but what is clear is that in high-income countries, such as Australia, radical shifts in guidelines and diets need to be made. A common misconception is that a plant-based food system cannot produce enough food to feed 10 billion people. However, the science refutes this argument. The paper highlighted shows that in the United States, plant-based replacements for each of the major animal categories, that is beef, pork, dairy, poultry, and eggs, can produce 2-fold to 20-fold more nutritionally similar food per unit cropland. Replacing all animal-based items with plant-based replacements could add enough food to feed 350 million additional Americans, and this is more than the expected benefits of eliminating all food waste. Some studies from Australia have shown that a sustainable plant-based diet is of similar cost to the current diet of Australians, but we must, of course, appreciate that currently healthy diets are likely to be unaffordable for low-income households, costing more than 30% of their disposable income. This is where we need to find local solutions to ensure healthy and sustainable diets are in fact affordable for all. The update of the Australian dietary guidelines is a huge opportunity. The World Wildlife Fund report on the restorative power of plant-based diets highlights that national dietary guidelines are important tools for changing diets and acting as a bridge between global recommendations and local context and relevance. Current national dietary guidelines, however, are not ambitious enough to achieve global goals and commitments. You'll hear today that some countries have taken significant steps to promote healthy and sustainable diet patterns. Canada recently launched a food guide that recommends half the plate of fruits and vegetables, a quarter of the plate whole grain foods, and emphasizes obtaining protein from plant-based sources such as beans, lentils, and nuts. Additionally, you will see that dairy has been removed as a food group. The science is clear on what constitutes a healthy and sustainable diet, but the challenge comes with implementation. Access to healthy, nutritious food needs to be considered a human right. Governments need to focus on supporting farmers to produce the food that promotes health and sustainable farming systems. We need to control advertising and marketing of food that causes harm. Our education systems need to support the implementation of dietary guidelines, and they need to be showcased in all public sector settings. The good news is that we can each make a positive contribution, as the power really is on our plate. Thank you.